La conferencia, bueno, la charla que va a ser más que nada responder también preguntas y dudas que tengáis sobre este proceso que estamos viviendo en España y en el mundo, que es el coronavirus. Entonces al doctor Borrás le conocéis muchísimos y muchísimas de vosotros seguro, porque bueno, es un médico bilingüe que conocemos de mucho tiempo y ayuda muchísimo a estudiantes. Como os decimos siempre, os recomendamos siempre, por favor, que tengáis cualquier cosa, cualquier enfermedad, por pequeña que parezca, es mejor hacer una cita, ¿vale? Y que os mire a dejar que se haga más grande, ¿vale? Entonces ya le conocéis, ya veis que va a ser muy fácil contactar para próximas ocasiones y vamos a dejar que hable en inglés, ¿vale? Para que sea más fácil. Sobre todo esto, y muchísimas gracias por venir, sobre todo, y por ayudarnos.
Gracias. Well, good evening. It's a pleasure to be here with you today, and we're going to be discussing in the next few minutes some facts that probably many of you already know about the coronavirus, but evidently it's one of the topics that everybody's talking about. It has generated a lot of concern. And it is important that we are well aware of the facts that are known, and especially what we can do about this. Because if we know what we can do, and if we know what's going on, we will be able to be better prepared and better protected. You're familiar with the fact that this virus, the coronavirus, is actually more than a virus, it's a family of viruses. It's a family of viruses that are transmitted within all the animals, but every so often what's called a slip over takes place. And this happens that the virus goes from, not only affects animals, but it also can affect humans. And this is not the first time that a coronavirus has caused problems. In the past you may have heard about SARS, you may have heard about MERS, and those were conditions caused by other types of coronaviruses. And now we have what's called the COVID, and that's the disease that's caused by the coronavirus 19. Actually, in the media, in the press, you'll hear people talking about the COVID virus. That's technically wrong. The COVID is the disease caused by the SARS-CoV-2 virus, but that's too complicated to use as a term. So that's why everybody's talking about COVID-19, and we'll use that term because it's probably the one that you're familiar with. Well, this virus was first detected in December 19 in the province of Wuhan in China, and since then, in a little over 3 months, more than 90,000 people worldwide have been infected by this virus, and more than 80,000 in the area of China and the rest worldwide. And in Spain, it didn't happen immediately, like it didn't happen immediately in the rest of the European countries or in the US, but now we have over 200 cases of people who have been diagnosed already with the coronavirus, with the vast majority of them being people who have been either in the areas where there has been a greater degree of infection, namely China, but also in Spain, a lot of people who have been in contact either directly or had traveled to some parts of the northern part of Italy, in the provinces, in the area of Milan, and the area of Venice, etc. So that's the situation that we have in regards to this virus. We know that it's a virus that's transmitted, it has an airborne transmission. What does that mean? That means that it's transmitted through the droplets that are formed when a person who has the disease coughs or sneezes. And this is very important to keep in mind. A person who has the virus, if he or she isn't coughing or sneezing, is not transmitting the infection just by their sole presence, just because they're there. It's only through those droplets that we know that the transmission is taking place. And not all the respiratory droplets are the same. For example, the person who has tuberculosis has the ability of transmitting the disease through smaller droplets than the ones that tend to transmit the COVID-19. What does that mean? That means that they can only be carried through the air up to a certain distance. A distance that's never beyond 8 feet, not more than 2 meters. That's why if someone with the condition, with the COVID condition, if I were coughing, the front row should be concerned, but the middle rows shouldn't have to worry at all, and the back rows could even ignore that situation. I'm telling you this so that you understand that the distance factor is an important factor, and that's why when we talk about some preventive measures, those include a lot that have to do with common sense. Whenever we are in a situation in which people could potentially be transmitting things, well, trying to avoid areas that are fully crowded does make sense. But it doesn't have to affect in a normal classroom setting unless you're elbow to elbow and someone's coughing on top of you. And we expect that if anybody would be in that situation, they would know that they shouldn't be in that setting in order to prevent transmission. What do we know about? What facts do we know that could affect this? Is it contagious? Of course it is. It is quite contagious. That's why in less than 3 months, it's affected more than 70 countries worldwide, and it continues to be spread. Is that rare? Not at all. That was expected from the very beginning that moved out from China. Why is it? Because people travel worldwide. And people are exposed to others who are traveling. So this isn't surprising. Of course, we would have loved not to see this happening, but the reality is that that's something expected, just like it is expected during the flu season that people will transmit will contract the flu or other viral infections just like this. Because the reality, and this is a fact that you need to grasp and understand clearly, that around 97% of those cured that will be infected with the virus will cure without complications. 97% of those who contract, who get the infection, who receive the virus, will cure without complications. There is a 3% that may suffer consequences of this, and usually it's going to be, in the majority of the cases, people who have chronic underlying conditions. What are chronic underlying conditions? Well, a patient who has a severe heart condition, a person who has respiratory problems, a patient who may have a diabetes that is out of control, or a kidney failure. Those are the patients who potentially may have the complications. Does that mean that they will necessarily suffer them? No. It just means that in those cases, if anybody knows that their situation makes them a little more at risk or more at risk, they have to be more cautious and prevent the condition more. But we need to know that in young, healthy people, we're not going to be getting that condition in more than 80% of the cases, and 97% of the infections will cure without complications. If we compare this to the flu, keep in mind that last year, only in Spain, more than 500,000 cases of flu infections were reported. 500,000 cases. And I can tell you that none of us were fully aware, except for those who are in the medical field, about such a situation. Yet what's happening now is because it's a new condition and it's definitely, people are alarmed by it, we're becoming aware of every single new case that is appearing. If you think that the flu season lasts for around 5-6 months, and you divide each of those cases, each of those 500,000 cases by 5 or 6, you get 100,000 cases per month. If you divide by 30, you would be getting 3,000 notifications of new flu cases every single day. In proportion, that's what's happening right now. When you click on your cell phone, you're receiving news that so many new cases have happened today. And if you have your computer on the entire day, you'll get the report on an hourly basis. And that is what's causing and generating a lot of tension, a lot of stress, a lot of fear. But once again, if this would have been done last year with the 500,000 cases of flu, you can imagine that we would have all gone in panic mode. And it didn't happen that way. And most people went through the flu season either suffering mild symptoms of the flu, and a few got complicated, and of those few complicated, those who had those chronic underlying conditions suffered more severe consequences of the flu. But nothing else happened. And it is likely that if things continue as they seem to be happening up to now, soon the situation may be similar. Now, once again, today we're talking about a condition that, as I'm explaining it, there are people who are doing a lot of research and trying to find out the better ways, the best ways to control the situation. So things are changing day by day, and things that we may say today, we may have to adjust in the next few days, because that's the reality when we're addressing a situation that is still happening. That's why people will be talking that this is a pandemic disease, because it's affecting the entire world. And that kind of brings a lot of fear into us. But a pandemic disease doesn't necessarily mean that it's more serious than other diseases that affect that have affected the entire world. The flu is also a pandemic disease. And yet we're not afraid of it, although we know that there are things that we can do in order to prevent that. And that is what we will be highlighting in the next few moments. We know that this disease has an incubation period that can go up to 2 weeks, 2 days to 2 weeks, although there are some cases that takes even a little longer. But 50% of the cases will develop symptoms within the first 5 days, within 5 days. So if someone is concerned that they've been having symptoms of respiratory condition for several weeks and even before all of this started, probably has to do with something totally different. It has to be something that has a more acute onset. The age groups that are affected, this is the good news that I have for the vast majority of you, is that 78% of all the cases are between 30 years and above. So most of you are younger than 30 years. So for the few of us, well, we can start looking into the statistics closely. For the majority of you, also that's good news. That's good news for all of you. But once again, statistics can be used in different ways, and you can use it to prove something and to disprove prove the opposite. But the truth of it is that more than 80% of those infected, I said it before, I want to highlight it again, will only develop, if they contract if they're infected by the virus, they will only develop mild symptoms. So I think that is something that we need to keep in mind, and that is the reality that is being seen with cases here in Spain, with cases in northern Italy, with cases in China as well. What symptoms will the coronavirus produce? That's the tricky part into it, because if I tell you they can produce a fever of around 100.4 Fahrenheit, that would be 38 Celsius. Headache and tiredness, and dry cough and shortness of breath, which are the 3 key symptoms. Well, probably all of you may think, well, I've had some of those symptoms in the past few weeks. I must have the coronavirus. That's the challenge that health workers are having when people come to them concerned. But the truth is that these symptoms can be caused by the common cold virus, by the influenza virus, by numerous conditions. So in the majority of the cases, when people have these symptoms, it's probably not the COVID-19, it's probably something else. However, common sense will dictate that if you've been exposed to someone who knows to have had the disease, or if you've been traveling to an area where the disease has become a greater problem, in the presence of these symptoms, you need to notify them so that the adequate measures can be taken place. So it's very important to keep this in mind. And as important as it is to know how what symptoms it has, it's even more important is what can we do about it? How can we prevent it? Can we do anything about it? And the truth is that we can do a lot, because the basic hygienic measures are what need to be taken place. And that's what all of you need to remember. What will those basic hygienic measures involve? Well, it's the same as in the flu. And the first one starts by washing your hands. So we would say that the answer is in your hands. Wash them. Well, Yes, washing hands has proven to be the most effective way of preventing transmission, not only of coronavirus, not only of influenza, but the vast majority of infections that affect worldwide would be prevented, more than 80% of the cases, if people would wash their hands. What does it mean? Do I have to explain what that means? Water and soap, and be generous about it. Make sure that you wash your hands thoroughly, in between the fingers, under your nails as well, fingernails as well. Wash your hands. If you do that, you're really helping yourself, and you're really protected. Why is that? Because your hands is what allows you to contact what surrounds you. So if you wash your hands, you'll be able to prevent the condition from affecting you. Also, with your hands, try to avoiding your face, especially the area around the eyes, the nose, the mouth. Call it the teasing. Well, try to avoid touching yourself if you're in general, but especially if your hands aren't clean. So the next question is, what about hand sanitizers? They're all over the place. Well, those are great ways also to help you when soap and water is not available. But if you would have to decide whether is it better to use this product or soap and water, I would tell you soap and water is better. Plus, it won't irritate your skin quite as much because this has a high concentration of alcohol. So if you can, soap and water. When you're out on the street and then you're on the metro or in the bus and you feel like you want to and you need to keep your hands clean, then use the hand sanitizers, and this will be very helpful. Another basic measure is to cover your cough. And all of you have learned this from elementary school. It's not coughing on your hands. Sadly, a lot of people still cough, and it looks like they want to spread germs all over the place. That's terrible. But another bad thing is just to cough on your hand, because the next thing that happens is that hand will use to shake someone else's hand to open the door, and the doorknob then gets infected, and that's the way it's transmitted. So this would mean that if you cover your cough, you're not only protecting yourself in the sense of, well, especially protecting other people, those who surround you. So covering your cough is also an important thing. Another question, people say, what about face masks? Are they useful? Should we be using them? Well, the CDC, the Center for Disease Control, the World Health Organization, up to date, they're saying very clearly that they're not recommended on the general population. And why is that? Well, first, because they should only be used by those who have either the disease in order to prevent it from spreading, or those who have serious underlying conditions to protect themselves more. But the rest of the population, there is not such concentration of the virus in the air to allow you to require you to have to wear a mask on such a continuous basis. That's why they're not recommending it. They're also another good reason is to ensure that they will be used whenever they're really needed, because not always people know how to use them correctly. There are different types of masks. The ones that don't have the filtering air system will prevent you from spreading it, but it won't prevent you from inhaling it if someone within a short distance of 8 feet or less, 2 meters or less, would be coughing. So that's why it's not recommended for the general population. Avoiding sharing personal household items would be another logical thing. But when you analyze all these things, should it be any different any other time? Shouldn't we all be doing this? Is it normal? Or shouldn't we be careful about sharing our drinks or glasses or ice cream cones, whatever, with other people? We should always keep these guidelines in mind. This means that if there's something positive that will come out of this, besides having greater knowledge about how these coronaviruses function, if we're all aware that if we are careful with our own personal hygiene, we can protect ourselves effectively, not only against this disease that we know about, but many other conditions that we may be not aware of. If we learn to practice these measures, we'll be better prepared and better protected for in the future other situations that may also be happening. And all those high-touch surfaces that are used by people need to be cleaned frequently. So just counters, keyboards, whiteboard areas, common areas where a lot of people sit, tables, etc. Well, contribute to helping keep that area clean. And in that way, we can also prevent the condition from being spread. So there's things that we can do. And we know that in doing these things, we can protect ourselves very effectively against COVID and against other conditions. Do we know what more? Do we know what else do we know about the disease? Do we know how to treat it? Well, just like with most viral diseases, there's no specific treatment. They're still trying to look into possibilities. And we have had relatively recent cases of other infections that affected large populations, such as the ones mentioned, SARS, MERS, Ebola, not so long ago. And actually, medication that has been used to treat other past infections are now being used with promising results. That's all I can say. Promising results, because we've had very little time, very little experience yet with it. But some cases have been treated with chloroquine, which is a standard treatment for malaria. Malaria has been out there for centuries. Some cases are being treated, and with good results, with anti-HIV, antiviral medications used for HIV. Other treatments that were used for Ebola are also being used in these cases. So, you know, a lot of research is being done, a lot of investigation is being done, and unfortunately, we don't have yet a vaccine. Whenever that happens, it is very likely that all the vaccines from now on will include, along with the seasonal flu, the virus for coronavirus, so that we can develop the antibodies needed to protect ourselves. So we're still seeing the condition, how it's evolving, and we're seeing it firsthand, and we will soon be seeing that the condition will have a different aspect. But of course, we still have to see how things evolve. So general guidelines while traveling will include, first and foremost, a lot of common sense. Common sense will dictate if now we know that a lot of cases have developed in certain provinces in Italy, northern Italy, well, common sense will indicate don't travel there until the condition and the authorities declare that zone to be safe. Actually, the U.S. Center for Disease Control has issued a threat level, the most severe threat level warning for traveling to China, South Korea, the areas of Lombardy and Veneto, with the cities of Milan and Venice, and Iran, strongly recommending against traveling to those areas. So, well, those are the general guidelines. And that's nothing that we can discuss. That's how it is. So until that changes, that's something that we need to abide by, and it makes sense. And of course, the area of China in which the condition started. But I know that this is a group that enjoys traveling, and I see that when you come and you tell me, well, I was this weekend in Berlin, I had a wonderful time. Next week we're going to Rome, and it's one of the neat things about studying abroad, the ability to travel. Does this mean that you can't travel? No, that doesn't mean you can't travel, but this means that you have to exert common sense when you travel. And as you travel, well, evidently avoiding personal contact with people suffering from acute respiratory conditions, that would be logical. I don't think I need to stress that, but I'm going to say it so that you know. And while you travel, you need to maintain the same personal hygiene that I've stressed here. Many times people think that when they travel and they go to a different place, we don't have to follow the same etiquette. No, you have to do the same things. Washing your hands still applies there. Covering your cough still applies there. Being reasonable in what you do. And since this is a virus that has originated from animals and then spilled over to humans, common sense will indicate it, and it's a strong recommendation, not to eat undercooked food or raw food in this scenario. So this is something to keep in mind. Once again, this is common sense. What about someone who has come from an area in which all of a sudden they tell you, hey, there have been more cases there than we thought there would, like people who came from Milan after the Fashion Week, etc. Well, if you return from an area where there have been cases, and you're feeling, if you're in good health, there's no reason to isolate yourself. If you're in good health, carry on with your normal life, but be aware that perhaps you may have been exposed. So if you start noticing symptoms and you've been in an area where there have been all these cases, then that needs to be notified. How should that be notified? In this particular case, the notification has to be centralized through the emergency number 112. And this is something that I need to explain. I'm always more than happy to see any of you at the clinic. But when we're considering a condition like this, in which if there's symptoms that are intense enough, they're going to require carrying some tests. Those tests are only done in hospital settings. That's why the first thing that needs to happen when these symptoms are identified and you suspect that there's a strong possibility, communicate by phone. No virus is transmitted that way. We can interview you and say, is it because you were in the northern Italy? Is it because someone you know has been diagnosed with this, etc.? And then we can tell you the steps to follow. But that's how things should be done. So keep in mind, so that we avoid transmitting the disease into other people in an unnecessary way. There are numerous web pages that are giving a lot of information. The website of the Spanish Ministry of Health has information, both in Spanish, of course, but also in English. The webpage of the Center for Disease Control will give you updated information on a daily basis. The U.S. Embassy will also give you information on a regular basis. All of those are reliable sources. Go to reliable sources to obtain reliable information. And having said all these things, I want to go back to where I began. It is a condition that we're all concerned about because it's new to us. We're still seeing how things are going to be evolving. But from what we're seeing, it looks like that although new cases are likely to keep happening for a period of time, after that they will plateau and then start decreasing and things will go back to normal. Once again, we're still functioning with the data that we have right now, and we have to elaborate all these guidelines with that information. And therefore, all of this is just an assessment guide. If things change, we will have to adjust to those changes. But as for it is right now, there shouldn't be no more reason of concern other than making sure that we do exert common sense in everything that we do, that we maintain good personal hygiene, and we follow the general guidelines that have been given. So this was the basic information that I wanted to review. I know that for most of you, this is not really that new because you're fully aware of it. I don't know if you have any specific question or any concern that I could help address that could be interesting to the group. And if it's something very personal, we can talk about it in a private conversation. Do you have any question? You're a great group, huh? Wonderful. Well, thank you.